And welcome to a new edition of Education Best Medicine. You just saw one of our mini inserts. Hope you enjoyed it. I'm George Pearson, I'm a physician assistant. I've been practicing about 35 years community. Thanks for watching. Thanks to Facebook family and all those folks that kind of like helped me do this. Curtis, thank you very much. Appreciate you. And today is March. March is it's been a serious thing. Women's History Month, colon cancer, um, self-injury, a lot of interesting things. But also, um, this month is Kidney Month. And what is the kidney? They call it a kind of a bean-shaped organ in the back of the back, attached to your urethra, and it goes to the bladder. So the kidney, I consider to be the chemist, and whatever you want to do in your body, if the kidneys aren't working, you can't do it. So it's Kidney Month, and this is March, dedicated to raising awareness of kidney health. And again, this is from GTB Chat. And again, a series of things I bring in from GTB Chat, and um, also up to date and just the general medical literature, because I try to be current. So we really are working on that, and I'm a real believer in information-based, evidence-based medicine that can be found in the literature and reviewed just like I do it. So, um, and we want to talk about the importance of early detection, and for those that are affected with kidney-related conditions. I hope this helps, and it certainly brought some light to my eyes as I get into understanding some other treatment modalities. And just wanted to say that this is dedicated to all those that have had kidney issues, continue to have kidney issues, to live with kidney issues, be it from chronic bladder infections to chronic kidney infections to the need for dialysis, peritoneal or blood based. That's the dialysis centers. That's the Vita, hemo. So it's done through the blood. Um, so the I think again we're going to talk about the importance of early treatment, and I am going to touch on hemodialysis. I'm going to cut this program into two halves. One half is going to be on kidney disease, and the other half is going to be on traumatic brain injury. Some interesting stuff there too. So uh, we'll get to it. And so definition of chronic kidney disease, or CKD, is defined as the presence of kidney damage, and usually they account for it through the detection of albumin, which is a molecule in the blood, and they measure it, and if it goes over a certain amount, usually 30 milligrams in a day, and also a decreased kidney function, and we use what's called the estimated glomerular filtration rate, which measures the ability of the kidney to screen. And if it falls below 60, then for greater than 3 months, then and irrespective of cause, we call that chronic kidney disease. Um, and sometimes these things are asymptomatic. People can be having renal disease, chronic renal disease, then no problem. But then as the body calls on the sick kidney to do more, it can't, and thereby other conditions exist, and we'll talk about this. So some of the complications of chronic kidney disease. It does have an increase for cardiovascular disease, and thereby end-stage renal disease, and thereby the risk of infection, and even cancer, and even death. So my story here is about prevention and promotion to prevent that from happening. So a majority of folks that follow the guidelines as best they can and eat properly and have a renal diet, and we'll talk about that. And just, take care of themselves and take their medicines timely, tend to do relatively well. And there's always the risk of anything. I think the biggest thing I understand is immune compromisation in this era of COVID and the risk that folks that are renal patients uh, were running from death due to COVID-related issues. And so that's the real thing. And take-home message for me about immunocompromisation and what can we do to enhance that. Good water, good food. Um, I'm not talking about just drinking water, but usually have a water from a source that you consider to be safe. And I'm not talking about our present water company. You might need to invest in a filtration system or have your water bought in. And that's another story. So, uh, again, we talk about the complications. So, the complications from the loss of kidney function also uh, can change the way your electrolytes, potassium, chloride, uh, magnesium, all those chemicals in your body and how they interact. And so, again, I always said that the kidney is the chemist, and that's what we use it for. Um, it also can affect hormonal systems and some of the common issues is not wanting to eat, nausea, vomiting, fatigue, elevations in blood pressure, anemia, and and certainly the kidney also helps for in terms of nutrition. So when it's sick, you can't take on nutrients as well as you like to, and so therefore a lot of folks lose weight. And that's one of the things that is important in kidney health and kidney dialysis. That it's again is essential to life, and that's how we treat it. And also risk of bone disease, so more prone to fracture. So a host of things as we talk about chronic kidney disease and its onset and some of the symptomatology. Again, sometimes they no symptoms, but most of the time you start to have a constellation system to send you to the provider to be seen. And so that's kind of where I'm at. Um, so slowing the progression of kidney disease, this includes blood pressure control, as well as new additional therapies to prevent the increase of albumin into the bloodstream. And again, when we measure that when it gets between uh, measuring between 30 and 300 milligrams is kind of an issue, and we want to address that. Um, and I want to give a shout out to my niece, Kayla Bridges. She is working in nephrology, and I think it's exciting for her. She just became a mentored NP, and I think she's working in Sacramento. So much shout out and much love. I'm really excited that she's in healthcare. So the optimal medical care in terms of late stage care has to be a team. And it's a team care approach that can include um, in some cases, the primary care, and on most cases, primary care provider, nephrologist, urologist, nutritionist, um, pharmacologist, uh, again, managing the whole person. So one of the things I found is that these conditions no longer can be done by one person or managed by one person. It should always be a team concept to the management of an individual with chronic kidney disease or any condition for that matter. Hypertension, diabetes, I find the team approach and through the literature tends to say that this gives the person the best chance of less disease, less death. And also, I'm an individual that believes in shared decision making. So this makes that individual who's having to be affected by all these changes part of the team in the decision making about their care, whatever that is. And so with this, the major discussion will be planning for if the kidneys stop functioning, if they again through start to uh, not be able to do the job of screening the blood, evident in blood work, which means elevated albumin in the uh, blood pressure, those kinds of things. And we have to look at planning for kidney replacement therapy. And what does that entail? It's important to identify patients who may eventually require kidney replacement therapy. Such adequate preparation can decrease death and protect even mortality. So, team approach, get the kidney replacement therapy in the provider's plan and bringing that team around as the person's kidney disease progresses. Um, and also get on the transplant list. And the story about the transplant list is that at one time African Americans weren't on the transplant list because they didn't consider them important enough to place on the transplant list. So the transplants in their early awnings went to white folks. And it was a whole big issue about the list and how people got on the list. And part of this discussion around, believe it or not, DEI, diversity, equity, inclusion, is as simple as having a renal list that includes everyone in it and does not exclude anyone. That's, to me, is a real DEI. That the folks that I know 15 years ago wouldn't have access to nephrology services, be seen by a nephrologist, be handled by a care team, is no longer the case. Now it's just getting the care. And there's still racism and institutional racism involved in the care of all people of color, particularly African Americans. It's quite clear. So why would you want DEI? Because diversity, equity, inclusion means that you treat me like I'm equal, and maybe in the society they're not ready for that, but they're not ready for a lot of things. And it's not going to turn out the way they think it's going to turn out. So counseling should take place, and you get on the list. And it's conservative kidney management, and that means options for patients not to pursue anything at all or to engage in the team as they progress, because kidney disease will progress. Let's be clear about that. It's a progressive disease. It's a progressive chronic disease, and it will not abate itself. It won't get slow. It won't stop. It will roll you over. So the issue is the end. Get on a team, get into early intervention, get on the transplant list, and look at your options so that you can decide intelligently. That's why I'm bringing up peritoneal dialysis, because it's something that people that are considering or should consider or need to consider as one of the options, as opposed to hemodialysis, which is done in the DaVita centers. There's the blood exchange, and you go 3 days a week and that kind of thing. So, hey, it takes more horses to have a horse race. So let's look at those options. So, some key facts about the kidney and kidney disease. Kidney vital function. The kidneys are essential organs to filter waste, excess fluids, and toxins from the blood. They also help regulate blood pressure balance, electrolytes, and they produce red blood cells and maintain bone health by managing calcium levels. So that's why I'm about the chemist approach to the kidney. And I want to thank all the folks on Facebook Live for watching and communion. And again, please interface, have a conversation, have a dialogue. I tape every second and third Saturdays from 2 to 3. So please, but I think I bring up some interesting things, and I think we can have a conversation as it relates from a cultural perspective to African Americans in America and the community as a whole. Kidney disease prevalence. 1 in 7 in the U.S., or roughly 37 million folk, have kidney disease. 1 in 7. So if you go down the street and you count 7 persons, that the first person you count 7, that one of those 7 has kidney disease. Many people with kidney disease are unaware of their condition. condition, and it becomes severe as symptoms develop. So early diagnosis, early evaluation, because it can be very progressive. And I've picked up some cases where, folks had level 3 kidney disease and didn't even know it because they weren't having any symptoms. And you had to look at the lab work and see that there was a concern and an issue in how we rated. In fact, the lab work tells you it's a problem. So anyway, that's always a discussion about, care, and do you care? Are you looking at everything you can as a provider, as a patient, as a system to ensure we provide the best product and early diagnosis and early treatment? So, 1 in 7, now that's a lot. End-stage renal disease, the final stage of chronic kidney disease occurs, and that may not happen for years. You can have changes in your kidney over time, but at some point, the kidneys fail. Uh, Even with good blood pressure control, even with good blood sugar control, I'm finding a lot more folks that have diabetes are starting to have renal disease. So this is why we want to adjust. A lot more people with elevated lipid problems are having a lot more problems with kidney disease. Sugar, sugar, fat, pressure invading those vessels and causing inflammation. So the body is attacking these uh, substances that shouldn't be in the bloodstream in the first place. This is why a balanced diet is important. This is why a plant-based diet is important. This is why minimizing sugar, salt, um, tobacco, alcohol out of here. Because your kidneys have to screen them. And if your kidneys can't screen it, it's tough enough having to deal with these foodstuffs that are, one, heavy laden in chemical particle stuff that the kidney has to screen. So it's tough enough dealing with that. And pollution, believe it or not, inhale the particulate matter passes through the kidney. So we have a lot of things that a kidney 6 million years ago didn't have to deal with. And it's affecting us. Not only include the emotional, psychological issues of how you're feeling. So, end-stage renal disease, again, it's the final stage. It's when the kidneys have lost most of their function. We're usually talking about 10 to 15% from the literature that I read. And requiring dialysis, and again, 10 to 15% given those symptoms. If you're starting to have swollen legs and you're tired and your bones are hurting, then you need to be either heading toward your team for dialysis consult, in which you could either do hemodialysis or peritoneal dialysis, and I'm advocating for treatment. So that's my job. I'm advocating because maybe 100 years ago, people were dying from simple chronic kidney disease, literally. So now the window is pretty open, pretty bright for care that allows a person to function as they would normally. So anyway, the risk for kidney disease. Well, so there are 785,000 Americans, 785,000, 78K living with end-stage renal disease. And for those folks that are doing it, you're doing a heroic job. Thank you for being who you are and making me a better clinician. Risk factors for kidney disease. And the reason why I say that is that it gets into an overall discussion about people's health. Because really the kidney disease is a cardiac issue. It makes you more at risk for heart attack and stroke. So it's always been my emphasis. I tell the folks I take care of is two pots. It's the heart disease pot, and then there's the cancer pot. And if we're not addressing one and screening for the other, and addressing one, then we lose the majority of people and what they're going to die from. So again, I'm a proactive versus reactive clinician, and that's what I like to do. So that's where it's at. I want to thank you. This is Believe Radio, 24-hour inspirational gospel music station. Just saw a visit to the other aspects of Believe Radio. Please watch it, check it out. I ain't a hater. There's a lot of interesting stuff. A lot of good things going on. We haven't been doing a part of the healthcare component, so please. It's a yeah, check Curtis's show out. Interesting. There's a lot of intellectual, spiritual, uh, and just the black man of the people. So that's what I think. So risk factors for kidney disease. So we're at what? We're at almost 21 minutes. I said half an hour on kidney disease, and so we'll do what we can. The risk factors for kidney disease: diabetes, uh, non-common, heart, high blood pressure, family history, age, heart disease, obesity, and medicines. I would say, particularly non-steroidal anti-inflammatories. Um, Symptoms for kidney disease: swelling of the lower legs, ankles and feet, fatigue and weakness, changes in urination, more or less frequently, usually dark colored, shortness of breath, high blood pressure, nausea or vomiting, loss of appetite. That's an end-stage renal. That could be symptomatology that progresses to end-stage renal disease. So what do you do? Regular checkup, manage the risk factors, maintain healthy lifestyle. And the treatment, of course, is either dialysis or renal transplant. And as we talk about this, I want to talk about in this segment uh, the use of peritoneal dialysis. This is all the up to date, recently reviewed this morning, in fact. Um, Evaluate the patient for chronic peritoneal dialysis and section modality. And then again, it says, at this time, a life plan for kidney care should be discussed. The life plan, which takes into account the patient's goals, access options, and timelines for care, acknowledges that the patient may require more, a little bit more, than one kidney modality over the course of his or her lifetime. And so it's a moving target. We keep it moving. Okay? So the life plan must continue to adapt to the changes in the patient's clinical course. The same patient may end up having a well-functioning allograft, which is when the allograft is one of the grafts they use for hemodialysis, for 20 years and then require dialysis again because of the allograft failure. Or in some cases, no place to put the catheter or the graft. They can't handle the pressure from years of kidney disease. And so other options have to be addressed, and one of those is peritoneal dialysis. And it's the perineum in the stomach. So there's a lining called the peritoneum in the stomach where a catheter is placed in, and this catheter allows for these fluids to be, it's explained to me, a tea bag, right? You have a clear glass of water, you put the tea bag in, and the tea becomes tea colored, and you pull it out. And that's how the dialysis system kind of works in regards to removing those fluids, because those fluids are now toxic. That's what the kidney has not been screening. And so, and with peritoneal dialysis, the biggest thing is the catheter, and the biggest thing is, folks know I do this show between 2 and 3. I tell them I do it between 2 and 3, and they still call. Anyway, thank you for being patient. We're going to continue this. It's about 2:24, and I want to thank you for. I want to thank you for watching. So, and in fact, in peritoneal dialysis, within hours of the placement of, in fact, the peritoneal dialysis catheter may be used within hours of its placement. So it's a catheter system. It's placed in by a surgeon. It's a one-day surgery, and it's really, really, really quick and safe. So, um, and so the catheter requires flushing, and usually the 1 liter solution. Again, all these things will be explained as you educate yourself about these things, as I educate myself about these things in terms of the proper catheter, and now they've got a system. It's a automated dialysis system that I think is the game changer for this kind of stuff. Uh, some and so even so they do the surgery. Sometimes they'll bury the catheter inside the tissue so that when you get ready to use it, and it takes about 2 weeks for it to heal. You're going through classes ongoing, and so I think it's something that when done properly, makes sense to me and I learned. So, and the big thing with this particular method is that it counts on some residual kidney function. So even that kidney that's been working for 20 years and pooped out has maybe at last count a 10 to 15% reservoir. This is used with the perodialysis as a benefit because again it helps clear the liquid. So along with the system and the partial percentage of the kidney function, you're back to maybe 80, 70%. Again, ongoing peaks. So it's easy to provide adequate peritoneal dialysis when clearance provided by the residual kidney function can be added to the provided by dialysis for the total required clearance. This allows for a flexible dialysis schedule and usually more acceptable to the patient. So one of the things with peritoneal dialysis is that it allows the individual to map their own schedule for dialysis. That's what I'm understanding from the take-home message. It's minimal or no abdominal surgery. And one of the things around the dialysis is that the peritoneal area cannot be compromised by surgical insult. In other words, you can't have scars or adhesion because it's like having I think something like a scarred mattress. That instead of you laying flat on the mattress, there's cuts in between, so the fluid would move in, move out, but it's supposed to stay over the mattress or in the peritoneum. So some of the things that were brought up is you should be able to understand instructions and be able to communicate. You should have sufficient eyesight, manual strength, dexterity, suitable environment to store supplies and perform the exchanges. The only absolute contraindication to treatment with perioditis is a lack of functional peritoneal membrane. Thus, almost all barriers are relatively dependent upon the motivation of the patient and the clinical experience of the clinician and the dialysis center, and the family members are going to help with this. All hands on deck. And so that's a real big one. It's one of the issues with peritoneal dialysis. You can't have any scarring of the abdomen area. That means folks that have multiple surgeries, and maybe they did. I hate to say it, but maybe they did a surgery for weight loss. Those would be issues with that. So, yeah, again, and any kind of gallbladder or bowel perforation, because it would again compromise the texture of the peritoneal area, and so it's going to be another recommendation against it. Again, always got to get on the transplant list, and that kind of thing. And there's new discoveries every day going on. So, physical, cognitive, or psychological impairment, one of the reasons you shouldn't do it. Occasionally, patients are unable to perform the dialysis procedure due to physical impairment, amputations, physical debility, and or the caregiver is not available for help. So again, one of the reasons you might not be able to do this issue, but from what I'm seeing, I think that a majority of people should be able to do this. Lack of vision is not a contraindication. Blind patients may perform peritoneal dialysis without using connection. We're using assisted connection devices, which is one of the options for folks with limited hand strength. Occasional lack of cognitive ability for both patient and the available caregiver are barriers to performing the procedure. But again, you gotta work this out. Anyone, you gotta learn this. That's I understand it, but again, you've got to just do it. Although peritoneal dialysis is simple to learn and perform, patients are given a series of steps either written by or by video or audio technology to review every time they perform an exchange. Sometimes both the patient and caregiver are not able to follow these steps. I believe that given all that and repetitious failure will allow you to one day learn it. Most people will be able to do this at one point or another. uh, Lack of appropriate environment. You can have a nice room, and uh, that's really really important. And so some of the people that probably again should have dialysis are active in family disease, irritable bowel, diverticulitis, probably Crohn's disease also, having surgical ostomies, and then, but the Holy Grail is the automated peritoneal dialysis. APD is used as a cycler to perform multiple overnight exchanges, resulting in multiple short dwells, variations of APD of the. So this unit, once used, allows for programmed dialysis, or in fact during sleeping, or sectionally. So that's why I'm kind of focusing on it, because I think that the system that they have in place now allows for flexibility and freedom and decreased infection, because you're not dealing with blood, you're dealing with the fluids, and the major issue that I see is infection around the site, and so um, that's it. And discussion around the modality again, and you can have one size doesn't always fit all, but you can have continuous peritoneal dialysis. You can have nightly intermittent. You can pick your flavor of dialysis, and can do it when you want to. It could be like the McDonald's of a dialysis. You can have it your way. Yeah. Okay. Anyway, I think that folks need to be okay with it. They do a test of it. So what is this into? The importance of Kidney Month to raise awareness, and final. They want you. There's a standard system that does not use the machine because of power outages. Then they want everyone to learn both methods. One is a standing pole system that but you're tethered to the pole. Okay, and one is the electronic method, APD method. They want you to learn both, which are when you choose. I think most people tend to use the APD, but again, if you're homeless and you don't have power, you use the standard method. So again, so I bring it up to say the importance of Kidney Month is to raise awareness. Uh, kidney Kidney Month helps bring into the attention the often overlooked issue of kidney health. It provides a platform for organizations, healthcare providers, and individuals to educate public and prevent and to do early prevention and detection, like we're doing now, to promote education, to encourage action. Why kidney health matters. Kidneys are vital in keeping the body fluids in balance, filtering waste, and maintaining overall well-being. Chronic kidney disease is a silent epidemic because symptoms don't often appear until the disease has progressed significantly, making it early detection, and crucial to preventing kidney failure. I think I've had that. I've had in the last, and why I'm bringing this up, in the last couple of months, I've had cases where the abnormal tests had been sitting in the chart and no one took the look at it and put two and two together and say, four, you need to be seeing the nephrologist. So, um, so how do you get involved during Kidney Month? Get screened. If you have risk factors for kidney disease like diabetes, high blood pressure, consider being tested. And that would be the a standard renal panel, meaning a BUN, creatinine, the estimated glomerular filtration rate. It's a renal panel. Share information, help raise awareness by sharing facts about kidney health with your family, friends, and community. Support kidney organizations. In summary, kidney must serve as a reminder to prioritize your kidney health and get tested and take steps to prevent kidney disease by raising awareness, early detection, the goal is to improve the health and well-being of those affected by kidney disease. 1 in 7, huh? 1 in 7 have kidney disease. 1 in 7. That 1 in 7 is you or your family or your leader. You owe it to them to get them in and get them seen so they can a get a hand on it. Um, Again, the numbers are staggering, and uh, as anything I say, we can do better. Let's do better. So that was a discussion about kidney disease and peritoneal dialysis and getting treatment. Um, and the next piece, another piece clear to my heart. March is just busy. Crickets, it's just crazy. Um, I have to say this. I just have to because I'm thinking about it. You know, I wish the people that spend their time trying to steal things from everybody else, hardworking folks, stop it and just get your own stuff. Quit taking other people's stuff electronically, verbally, all that stuff, because it ain't yours. It's not yours. Why keep stealing things that's not yours? You know. Anyway, just the FYI thought. One of my debit cards got compromised this morning, so I had to shut the card down. It happened this morning. I was in bed sleep. She's stealing from me in bed sleep. Anyway, let's talk about brain injury. Good segue. March is Natural Brain Injury Awareness Month. It's observed every March to raise awareness about brain injury with an impact on individuals and families. And for those folks caring for family members with brain injuries, providers, caregivers, those that understand the magnitude of this issue. And I want to say this, if I don't say anything else, when a person has a brain injury, they're doing the best that they can. Hopefully, we'll talk about this in terms of the structural problems and the chemical problems that doesn't allow that person, the person that you have there with their brain injury, maybe not to get back to that person just because the game has been changed. The structure has been changed. The chemicals have been changed in their brains. So just understand that as you're providing care and providing care for yourself, because boy, it's one of the toughest issues in medicine and in life and family. So this is March. It's about brain injuries, their impact on individuals and families, and the importance of prevention. Uh, a majority of these injuries can be prevented, but some of them can't because they happen as a result of car accidents or falls. Falls are more common. Car accidents takes a young person's world and flips it around. And so this month serves to highlight the often overlooked challenges faced by people with brain injuries and encourage efforts to reduce the incidence of traumatic brain injuries or TBIs through education and advocacy. So my career in working in the African American community and working in Oakland, gunshot wound TBIs. So gunshot wounds from to make brain injuries, not uncommon. Car accidents, assaults. That's how I see TBIs. So, not a pretty picture. Just not. So, traumatic brain injury is a major source of health loss and disability worldwide. Globally, the incidence, this is from GBT Chat, and this combination of also Up to Date, which is my go-to medical literature, Up to Date, right? Uh, It's a major source of health loss and disability worldwide. Globally, the annual incidence of TBI or traumatic brain injury is variably estimated to be between 27 to 69 million. Many survivors live with significant disabilities, resulting in a major socioeconomic burden. In 2010, uh, the economic impact of TBI in the United States was estimated to be about $76.5 billion in direct and indirect costs. And for the folks that are taking care of folks with TBIs, you're doing God's work. Now, the person that you want that person to be before the injury may not be, but the person there is the best person we can have. And we gotta love them down and be okay with that. You ain't done nothing wrong. It was just a test. Anyway. And most of you folks are passing the test. So, estimating the global burden. So, the head being. So, what are some of the causes? The head being struck by an object, the head striking an object, acceleration slash deceleration of the brain without direct external impact, a foreign body penetrating the brain, the force from a blast or explosion, other forces yet not to be determined. Global trends. Estimating global trends of TBI is challenging. For one, many patients with TBI, particularly those with mild injury, do not seek medical care. You saw that commercial where these melons, these two people, they got the shape of melons and they fall and hit their head. That's true. Sometimes the injuries have been 3 and 4 years old, particularly in our elderly population, or our young kids, or our football players. So, overall falls were the single most common cause of TBI, with road traffic injuries the second most common cause. I told you they were in there. And TBI is a typically characterized by a physiological disruption of brain function, such as a transient loss of consciousness or alterations in mental state at the time of the injury. So when the impact happens, that person loses consciousness. In some cases, has to be artificially maintained, breathing, tubes, intubation, or else the person dies until the brain has time to heal as best they can. So they do a score. It's called a Glasgow Coma Score. You check at the eyes, you listen to sensory, you inject, you provide water to the rectum. It's called call stimulation, you know, and they measure it for approximately 30 minutes. And let's see if I can bring it up. It's a list of eye opening, best verbal response, best motor response. So that's what they're asking. Are you here? What's your name? And depending on how they react, it's spontaneous, or in terms of eye opening, instant response to pain, or there's no eye opening at all. Best verbal response. It's the Glasgow Coma Score. It ain't sexy, but that's how they tell you whether that person has enough mental capabilities, is functioning, or they're brain dead. That's what it's used for. So, best verbal response. I can remember some moms, sons going down, and when the son said mother, she knew her child was going to be all right. And best motor response, he obeys commands, localized response to pain, pain check. So it is extensive, and the scoring determines the level that the person is. And the scores go between 13 to 15. Anything lower than that, you've got problems. Complicated MTI is characterized by clinical features consistent with by a traumatic. So you've had a brain bleed. Those are the most devastating because they have to suck the blood off the brain, and again, a lot of this is allowing the brain to heal as best it can. They do IV solutions to the brain, things like part sugar, part water, part electrolytes, to see if the brain will heal better. But you can't give too much because you could you could cause a swelling in the brain from fluid overload. So it's a delicate balance. The neurologist, nurse that team that handles those kinds of injuries. You know, there's a couple of teams that really, the cardiovascular team, the early prenatal team. Those, I mean, those are heroic. The brain neural teams, heroic, just heroic. And then there's the concussion, often used in the medical literature as somewhat empty, but it's not. Is specifically to describe the characteristic symptoms and signs of TBI. Unless the burden of TBI was found to be 3 times greater in low to middle countries compared with high income countries or lower income communities in terms of care, in terms of access to the care, in terms of people doing what they're doing. Lucky in this area, you got a Stanford, you got a UCSF, you got organ institutions that do these. They study them. Uh, the highest rate of TBI emergency visits was seen on older adults greater than age 75, to the very young age 0 to 4, and young adults was 15 to 24. TBI was just been classified using injury scores, the most common, the Glasgow Coma score. 8 or less measured on admission represents severe TBI. Remember, it's 13 to 15. So anything less than 13 is an issue. The score 9 to 12 traditionally has been represented as mild TBI, and a Glasgow of 13 to 15 was moderate, and the Glasgow score of 13 to 15 was mild TBI. So all gradients. Again, we're at 474, and so we had 247, and we're in Oakland, California. Thank you. This is Believe Radio, 24-hour inspirational gospels channel. I want to thank the organizational thought behind this, etymology, and Curtis, who just keeps the place running, open, and clean and nice. I appreciate him, because sometimes things happen. So, post-concussion syndrome. So, when a person has a TBI, it's measured by a Glasgow score. Normal is 13 to 15. Anything under that, you can have mild, moderate. You get mild, moderate, severe total brain injury. And that everything from alert and talking to somnolent and unconscious and needing a respiratory as well as support. So, post-concussion syndrome. Symptoms may result with brain injury from trauma involving head and neck structures. These typically include headache, dizziness, including vertigo. And I'm going to talk about vertigo because that's really significant. And you feel like you lost, but you can't stand. Well, when the brain is injured, that structure may be injured, so a person really doesn't believe they can stand. They really believe they need help. Again, it's not just the injury to the brain, it's the structure of the brain and the physiology of the brain, how it exchanges chemicals, nutrients. That's changed. So, this is again vertigo and non-specific dizziness, neuropsychiatric symptoms, anxiety, depression, fear, cognitive impairment, just a little bit slower, can't think as fast, and can't get sleep because you're afraid. Post-traumatic headaches. Headaches occur in 25 to 70% of patients. Again, that's a lot. So if you have a TBI, you can assume you're going to have a headache with it. Sleep disturbances. Sleep-wake disturbances are common among the prevalent sequelae of TBI. So when a person has a brain injury, they get him through or her through. They're in the hospital. They're rehabbing. These are things that they're having to deal with. Post-traumatic epilepsy. Got a question about whether someone should be on seizure medicines. Well, the discussion is, the concern is whether they were having one. And if they have one, what would that start? So they put folks on the medicines, and if they don't have any breakthrough seizures in a year, then they consider maybe reducing the medicines. But um, it's not recommended, but that's when you have to talk to the neurologist. That's when you have to talk to the team. So post-traumatic vertigo and dizziness. The incidence of post-traumatic vertigo and dizziness has not been well characterized in prospective studies. Post-traumatic vertigo and dizziness is a substantial contributor to the disability of TBI. So feeling dizzy, feeling off balance, feeling unsure, unsure stepping down, unsure walking up, movement. One of the reasons it might not be good to drive. So, and I think that one has to understand that the brain injury has a number of effects, and almost similar to dementia in terms of the trauma to the cells, trauma to the nerves. So that's the problem, and they're working on it. And there's a reported loss of taste as well as smell following this injury. So food just doesn't taste well. They can't smell it. They can't smell the perfume of their wife. It's an issue. Also, double vision from injuries to the third, fourth, and sixth nerve. The setting in mild TBI injury to the fourth nerve is most common, followed by the sixth nerve and the cranial three. These are all face, head, neck. And so what happened, this is an accumulation of these abnormal fluids in the brain space of the neurons, and it changes them. It changes their ability to communicate, changes their ability to function, and again, blood vessels are destroyed, and they become irregular in their pattern. So the whole neurovascular blood network is altered in a person that has had a significant TBI. That's why they're not the person you think they should be, because they're not going to be. But they're still here, and we still have to love on them. While most patients, 90%, and maybe well, required initial admission to intensive care unit. Patients with severe TBI were hospitalized for a longer duration over patients with moderate TBI versus 26 days versus 15 days. So the longer the person stood in the hospital, the more serious it was. Makes sense. And it took a while for them to get home. And they monitored with CTs, and it's a progressive neural disease, the trauma to the brain. So some of the understanding we have for CTE is limited by extensive work by the athletes, right? Yeah, man, there was a point in time that they think football players had chronic brain injuries. We know that to be the case. We want to thank an African American physician for finding that out, and probably taking a lot of heat from it because it changed with the National Football League, which is one of the most powerful business football entities in the world. So, in general, the core features are cognitive impairments, including memory and executive function, behavioral abnormalities, aggression and paranoia, impulsivity, mood disorder, depression, anxiety, suicidality. The combined acute and chronic mobility associated with TBI suggests placing a premium on reducing the number of concussions. Individuals, particularly older persons, have had one injury or more increased with recurrent hair injuries like falls. So more falls, more head injuries, more falls. So the question we have to ask is, I played football. I enjoyed it. I think if I hadn't played football, I would have been a different person. But we're in a different world now, and how are we going to make sure the young men and young women that want to play are not going to sustain injuries to the brain? Hey, excuse me. Jalen Hurts had a concussion 4 weeks before he won the Super Bowl. He had a concussion, which I believe was a TBI. They just didn't talk about it. Anyway, so TBIs can lead to several pathological, the most which can get divided on neuroimaging, skull fracture, bleeding under the brain, under the skull, epidural hematoma, a subdural hematoma, so bleeding under the brain, subarachnoid hemorrhage, or straight up bleed, interfemoral hemorrhage, cerebral contusion. So the brain being shook like a melon, being shook like a melon. We had five. Anyway, we got 56 more minutes. We got what, 4 minutes? I'll see what we can do here. Other considerations. Most important consideration for prognosis and treatment with severe TBI: different disease mechanisms, closed versus penetrating injuries. So the type of injury determines the recovery, and extracranial injury representing approximately 35% of cases. Multiple systemic traumatic injury can further exacerbate brain injuries because of the localized blood loss. Hey, hurting, getting your knee hurt. Other injuries that happen along a kind of accident paradigm when someone runs into your car. Secondary brain injury. Secondary brain TBI is usually considered as a cascade of molecular mechanisms that are initiated at the time of the initial trauma and continue for hours to days to years. How about that? However, the critical aspect of eliminating secondary brain injury after TBI is the avoidance of secondary brain insults, which would otherwise be well tolerated. So if you got the first one, as long as you don't get a second one, as long as they don't fall again, as long as not in another car accident, um, that kind of thing. And the classification. Key facts about brain injury. Types of brain injury: TBI, a sudden injury because is caused by external force, either a blow to the head or a fall or a car accident, and disrupts normal brain function. TBI can be ranged from mild concussion to severe acquired brain injury. Injury that occurs after birth, which can include TBI, as well as non-traumatic brain injuries caused by strokes, tumors, infections, and lack of oxygen. Prevalence: each year, more than 2.5 million people in the U.S. sustain a TBI. It is the leading cause of death and disability. Concussion and mild form of TBI are particularly common in contexts for military service, CTBI, right? Members and people involved in accidents. Again, put a piece out to our veterans, those that had TBI injuries. Thank you very much. Thank you for your service. Over 5 million people in the U.S. live with long-term effects of TBI. And symptoms of brain injury. Mild TBI symptoms that can include headache, dizziness, confusion, um, and memory problems, nausea, sensitivity to light or noise, temporary loss of consciousness. Moderate, severe TBI, more symptoms may include unconsciousness for an extended period, loss to including speaking, impaired coordination, changes in behavior, personality changes, or problem with motor skills. Falls, one of the most important causes of TBI, particularly in children under 4. Uh, uh, Falls in children under 4 and adults over 65. Motor vehicle accidents, sports injuries, violence, yeah, gunshot wounds, assaults, particularly abuse can cause brain injuries, sports injuries, consequences of the injuries, short-term and long-term effects. Brain injury can result in short-term issues with as headaches, dizziness, and confusion, as well as long-term issues including memory loss, cognitive impairment, emotional disturbance, and difficulty of motor skills. Impact on life. Severe brain injury can cause significant disability, impacting the ability to work, interact socially, and perform daily activities. Some individuals may need long-term rehabilitation and support. Don't give up. Don't give up the therapy. Don't give up the treatment. Please, it's needed. Mental health injuries can cause mental health. Brain injury can also increase the risk of developing mental health issues such as depression, anxiety, PTSD, especially if the person has experienced specific physical, cognitive, and emotional changes. Hey, I was doing this, and now I can't do this anymore. and people have to take care of me, and I was a self-sufficient person. Don't think a man don't think that. Don't think a woman don't think that. If not for the grace of God, then you. That's why we're here. So, one of the things is wear safety gear, wearing helmets, doing activities like biking, skiing, or contact sports, prevent falls, installing grab balls in the bathrooms, and using non-slip mats, and ensuring good lighting in the home can reduce the risk of falls, especially among elderly. Impact brain, and again, impact the brain injury month, raise awareness brain injuries, the opportunity to educate and educate the public about different types of brain injuries, and promote health detection, diagnosis. Don't ever give up. That's what I say. Don't ever give up. You can't give up. You can't give up, because if you give up, they gonna give up. Thank you. It's been great. Wish you all the best in the world. We will talk next time. Right in the middle of do a show taping. Man, God, you guys may have came on. So anyway, that's how it goes. What's happening? Right, but they said they were canceling it because they had something else to do. That's what she told me. Tomorrow morning. Okay. Um. Okay. Man, you guys are boy. I tell you. Let's do 10 o'clock. 10 o'clock tomorrow morning. Unless you can do it today. Yeah. Again, so 10 o'clock. Unless you can do it today.